Welcome to this video about the 2026 Medicare Part D prescription drug plans or PDPs. Here's what you'll learn. First, the 4 ways drugs are covered under Medicare. Next, the 2 parts of Medicare that include prescription drug coverage. Then, 2 ways to enroll in a Medicare drug plan. Next, who is required to have a prescription drug plan, and what are the penalties if you don't. Next, the costs associated with a Medicare drug plan. Then, what prescription drugs are covered in a plan. Also, the 3 cost-sharing phases. Next, how the Medicare Prescription Payment Plan or M3P works. Then, the Medicare Star Rating System. Finally, what to do if you need help paying for prescription drugs. So let's look at the 4 ways drugs are covered under Medicare. Medicare-approved drugs are covered differently in each part of Medicare. For example, Medicare Part A hospital insurance covers drugs necessary during a Medicare-covered stay in a hospital or skilled nursing facility. For example, drugs administered as part of your inpatient treatment during a covered hospital stay are included. Medications required during a covered stay in a skilled nursing facility are also covered. Finally, drugs for symptom control or pain relief for those receiving hospice care are also covered. Next, Medicare Part B, medical insurance, covers drugs typically administered in a doctor's office. These include COVID-19, flu, pneumonia, and hepatitis B vaccines. It also covers drugs used with durable medical equipment, such as nebulizers and infusion pumps. It also covers infusions and injectables. Next are Medicare Part C Advantage plans with Part D prescription drug coverage. These plans include drugs covered by both original Medicare Part A and Part B, plus Part D. Not all Advantage plans include Part D prescription drug coverage. Finally, Medicare Part D prescription drug plans. These standalone drug plans are used along with original Medicare Part A and Part B. These plans are for prescription drugs which you get from a pharmacy. Now let's take a closer look at the 2 parts of Medicare that offer prescription drugs. All Medicare prescription drug plans include these parts: drug formulary, drug tiers, annual deductible, copays, coinsurance, coverage phases, network pharmacies, plus the Medicare Prescription Payment Plan, M3P. A Medicare Part C Advantage plan can also include Part D prescription drug coverage, which includes all the same parts as a Medicare Part D standalone plan. A Medicare Advantage plan also has separate medical deductibles, copays, coinsurance, maximum out-of-pocket costs, provider networks, and supplemental benefits. Remember, the costs of prescription drugs are separate from the costs of medical services. Now let's look at the 2 ways to enroll in a Medicare prescription drug plan and late enrollment penalties. So, when can you sign up for Medicare prescription drug coverage? To get a Medicare Part D standalone prescription drug plan, you must first enroll in either original Medicare Part A or Part B. Typically, you have a Part D drug plan when you have chosen to stay on original Medicare. To get prescription drug coverage through a Medicare Part C Advantage plan, you must first enroll in both original Medicare Part A and Part B. Then switch to a Medicare Advantage plan with prescription drug coverage. Regardless of which Part D plan you choose, you must live in the plan's service area. So, does everyone age 65 and older have to have a prescription drug plan, even if they don't take any prescription drugs? The answer is yes. Medicare requires individuals 65 and older to have a prescription drug plan. If you don't have a drug plan, then Medicare will assess a late enrollment penalty for life once you do enroll in a Medicare prescription drug plan. The longer you wait, the higher the penalty. Late enrollment penalties are in addition to your monthly premium. So, how much is the penalty? Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium. In 2025, it's $34.70. Times the number of full uncovered months you didn't have Part D or other creditable prescription drug coverage, for example, from an employer. Now, let's look at the costs associated with a Medicare prescription drug plan. There are two basic costs associated with every prescription drug plan. First, the monthly premiums you pay every month for a plan. Second, the out-of-pocket costs you pay when you pick up your drugs at a pharmacy. These costs vary by plan. Use both amounts when determining which drug plan has the lowest overall costs. In addition, higher-income Medicare beneficiaries will pay more for prescription drug coverage in the form of a Part D IRMA surcharge. And finally, any late enrollment penalties will be added to your monthly bill by the insurance company as instructed by Medicare. So, which prescription drugs are covered in a Medicare prescription drug plan? Medicare requires that 6 classes of protected drugs be included in a plan's formulary. They are anticonvulsants, used to treat epilepsy and other seizure disorders; antidepressants, used to treat depression and other mood disorders; antineoplastics, used to treat cancer; antipsychotics, used to treat schizophrenia and other psychotic disorders; antiretrovirals, used to treat HIV/AIDS; immunosuppressants, used to prevent organ transplant rejection and treat certain autoimmune diseases. However, not all drugs are required to be covered by a Medicare Part D drug plan. Drugs excluded include drugs for controlling weight, lifestyle drugs, fertility, cosmetics, vitamins, and most over-the-counter drugs. Now let's explain what a drug formulary is. A drug formulary is a list of drugs, both generic and brand name, selected by an insurance company as the drugs they prefer to treat specific health conditions. This list is created by a committee of pharmacists and physicians from various medical specialties. They evaluate and select new and existing medications to be included in the formulary. Selections are based on the drug's therapeutic class, a group of medications known to treat a particular health condition. Insurance companies can change the drugs that they cover in their formulary. For example, they can switch from a brand name drug to a generic one. If your drug plan makes formulary changes during the year, you have certain rights depending on why the plan made the change. Specifically, if your plan is making maintenance changes, they must give you 60 days notice or provide you with a 60-day transition refill. If your drug is not part of the formulary, you may have to pay the full retail price for your drug. Medicare requires all drug plans to include a process for requesting a formulary exception. Many Part D drug plans have ways to manage access to certain prescription drugs. They include prior authorization, step therapy, or quantity limits. Check with your Medicare drug plan for specifics. Once a drug plan formulary is created, it then assigns each drug to one of 6 cost-sharing tiers. Starting from lowest to highest is Tier 1, preferred generic drugs, usually the lowest cost; Tier 2, generic drugs, slightly higher cost than Tier 1; Tier 3, preferred brand name drugs, higher cost than Tier 2. Next is Tier 4, non-preferred drugs, both generic and brand name, higher cost than Tier 3. Tier 5, specialty drugs, the highest cost, often used for complex or rare conditions. Finally, some enhanced plans offer Tier 6 drugs at a very low cost to promote adherence to essential therapies by reducing financial barriers. Each tier has different out-of-pocket costs, with lower tiers generally costing less than higher tiers. So, it's important to check each Part D drug plan to see if your specific prescription drug is available in their formulary and on which tier and cost. All Medicare prescription drug plans, both standalone Medicare Part D and Medicare Advantage Part C, cannot charge more than $35 per month for the insulin products they cover. Please note that plans are not required to cover all brands and types of insulin. So, what is covered by Medicare Part D? Injectable insulin, not used with a traditional insulin pump. Insulin used with a disposable insulin pump. Certain medical supplies used to inject insulin, like syringes, gauze, and alcohol swabs. Now let's cover pharmacy networks. Part D drug plans negotiate prices with pharmacies on the prescription drugs they offer. In-network pharmacies are either standard or preferred. Your out-of-pocket costs may be less if you use their preferred pharmacy network. Otherwise, You may pay more for your prescription drugs by using a standard pharmacy network. If you use an out-of-network pharmacy, then you'll pay full retail price. Always check the plan to see if your pharmacy is in network. If you switch to a different pharmacy, please notify your doctor's office. Then, when you arrive at your new pharmacy, show your prescription drug card, and your new pharmacist will apply plan discounts to determine your out-of-pocket costs. It's important to get the drug formulary from the Part D plan's website or service center. If a new drug is not in the plan's formulary, you may request an exemption or pay full price. You can also ask your doctor for an alternative drug, or you can change to another Part D drug plan once a year. When the preferred drug in your plan's formulary is not working for you, you may request a tier exception. A tier exception is when you request that a higher-cost non-preferred drug that may work better for you be moved to a lower-cost sharing tier. You can request a tier exception when the plan's preferred drug may not be as effective or have adverse effects or both. Check your plan's website to see if the specific drug you need is in the formulary and on which tier and cost. Your plan should have information on how to apply for a tier exception. Your physician can help you apply. Medicare Part D prescription drug plans must comply with Medicare requirements, allowing beneficiaries to request a formulary exception when the insurance company determines that the request is medically necessary. Your doctor can help you with any required documentation. Your share of the costs for your prescription drugs may change over a calendar year. So let's take a look at the 3 different cost-sharing phases found in a typical Medicare Part D prescription drug plan for calendar year 2026. In 2026, all Medicare Part D prescription drug plans have only 3 cost-sharing phases. They are the standard annual deductible, the initial coverage phase or copay phase, and the catastrophic coverage phase. As your total drug costs increase throughout the year, chances are you'll enter one or more of these cost-sharing phases. Medicare established 3 cost-sharing phases to help reduce how much you pay for prescription drugs. This cost is shared between you, the beneficiary, the Part D plan, the drug manufacturer, and Medicare. So, let's take a closer look at the standard cost-sharing amounts in each of these phases for calendar year 2026. The first cost-sharing phase is the annual deductible. In calendar year 2026, the standard deductible is $615. Not all plans may apply this annual deductible. Many plans may waive part or all of this amount on certain drug tiers to encourage compliance. Next, after the annual deductible, is the initial coverage phase. This is where you pay 25% of the retail cost of a drug, and the Part D drug plan pays 65% on brand name drugs. The drug manufacturer provides a 10% discount on brand name drugs. Medicare is not directly involved in this cost-sharing phase. However, many Part D drug plans have a mix of copays and coinsurance in this phase instead of the standard 25% coinsurance. This is why some enhanced plans may have maximum out-of-pocket costs of less than the standard $2,100 maximum. You generally stay in this phase until your true out-of-pocket costs reaches $2,100. After that, your out-of-pocket costs will be zero. That's because, in the catastrophic phase, the cost of drugs is shared between Medicare, your plan, and the drug manufacturers. In an enhanced plan, your maximum out-of-pocket costs may be lower than $2,100 due to the mix of deductibles, copays, and coinsurance on the specific drugs you use and the plan you have. So, what costs are not included in the maximum out-of-pocket costs? They are the Part D plan monthly premiums, IRMA surcharges, non-formulary medications not covered by your drug plan, bonus drugs from supplemental plans, medications not covered by your Medicare Part D drug plan. For example, over-the-counter drugs, or drugs covered by other parts of Medicare, like Medicare Part A or Part B, or drugs purchased through other pharmacy discount programs like GoodRx, or drugs purchased outside of the United States, or payments made by other prescription drug programs. like employer group health plans, the VA, TRICARE, or workers' compensation. Now, let's take a look at the Medicare Prescription Payment Plan, M3P. The Medicare Prescription Payment Plan is a new payment option that works with your current drug coverage. It helps you manage your out-of-pocket costs for drugs covered by your plan by spreading the costs across the remainder of the calendar year. All plans offer this payment option, and participation is voluntary. There's no cost to participate in the Medicare Prescription Payment Plan. So, who might benefit from the Medicare Prescription Payment Plan? Individuals with high initial out-of-pocket costs at the beginning of the plan year. For example, those who reach the $2,100 catastrophic phase early in the year may want to spread those costs over the remainder of the year. So, how does it work? If you select this payment option, you'll receive two bills: a bill for your plan's monthly premiums, plus a separate bill for your prescription drugs, instead of paying the pharmacy. Even though you won't pay for your drugs at the pharmacy, you're still responsible for all the costs. If you want to know what your drug will cost before you choose this option, call your plan or ask the pharmacist. Again, when you fill a prescription for a drug covered by Part D, you won't pay your pharmacy. It includes mail order and specialty pharmacies. So you'll receive a monthly bill based on what you would have paid for the prescriptions you get, plus your previous month balance. Then divide by the number of months left in the plan year. All plans use the same formula to calculate your monthly payments. Remember, this bill is in addition to your monthly plan premium. More importantly, your monthly payments may change every month, so you might not know what your exact bill will be ahead of time. Future payments might increase when you fill a new prescription or refill an existing prescription. Because as new out-of-pocket costs get added to your monthly payment, there are fewer months left in the year to spread out your remaining payments. The balance must be paid off by the last month of the plan year. Remember, this payment option might help you manage your monthly expenses, but it doesn't save you money or lower your drug costs. This payment option may not be for you. If your yearly drug costs are low, if your drug costs are the same each month, if you're considering signing up for the payment option late in the calendar year, or if you don't want to change how you pay for your drugs, if you get or are eligible for extra help from Medicare, if you get or are eligible for the Medicare Savings Program, if you get help paying for your drugs from other organizations like a state pharmaceutical assistance program, a coupon program, or other health coverage. Next, the Medicare Star Rating System provides an easy-to-understand way to evaluate and compare the overall quality of different plans in your area. This helps in making informed decisions about which plan might best meet your needs. Every year, each Medicare plan is given a star rating by Medicare, from 2 to 5 stars, with 5 being the highest. Higher ratings mean additional quality bonus payments from Medicare. So it's important for Medicare plans to keep their star ratings as high as possible. So look for a plan star rating when shopping for plans. Need help paying for prescription drugs? There are programs that can help. You may be eligible for extra help with your prescription drugs through the Social Security website or your state's pharmaceutical assistance program. In 2026, full benefits will be offered to Medicare beneficiaries who have limited resources and incomes at 150% of the federal poverty level. With full benefits, the majority, if not all, out-of-pocket costs for prescription medications will be covered. People who qualify for extra help will pay no deductible, no premium, and fixed lower copays for certain medications. Once you are on Medicare, the Medicare annual open enrollment period will be your opportunity to find a prescription drug plan that fits your needs for the next calendar year. So here are some dates to remember. Beginning on October 1st, you can discuss the new prescription drug plans with your agent, or 800 Medicare, or your state's SHIP counselors, or go online at medicare.gov. Next, enrollment in the new plans start October 15th and ends December 7th. The new plans go into effect on January 1st, 2026. Remember, if you don't enroll in a new standalone prescription drug plan, or PDP by December 7th, then you will have to wait an entire year in most cases. One last note, Medicare Part C Advantage plans with Part D prescription drug coverage are a bit more complex, so consult with your trusted certified agent first. So, do you need expert advice? Help learning which tiers your prescription drugs are on? Help finding lower-cost alternatives? Help on how your out-of-pocket cost may change during the year? And find a plan that has the lowest overall costs for you? Contact your trusted state-licensed, Medicare-certified, independent insurance agent for help. It doesn't cost any more to use an agent.